have, okay.
Also, you know about
Sorry.
Congress, what the hell?
The radio was going fucking obnoxiously loud, and I apologize. I have Irish for you is what I was trying to say.
You're
good, you're good.
Who's gonna help me?
Irish!
No, I'll help her if you can help Frisha. Thank you. Alright. Oh yeah, that's the wrong way. I haven't been on duty for a little bit, so it's gonna be a minute.
Oh, good.
Echo 44 plus 1, we are called for an call, treated on scene, 76 back to Hellbomb.
10-4, and who are we keeping an eye out for?
A crazy lady.
Well, that's not very helpful. You know, there's many ladies in the state. I don't know who I'm supposed to, you know, advise if I see.
I do believe the name is Nina Wise.
I'm sorry, what?
Nina Wise.
10-4. Ah, fuck. Right, I'm gonna go ahead and put this, machine on here. Alright, any, metal, have it taken off. I'm gonna go start that MRI once that's done, okay? Echo 46 is not gonna be allowed to be alone right now. Alright, I'm gonna have Dr. Octavius grab that necklace from you. I'm gonna start this MRI and see what we're looking at.
What's good?
Nina is the one who attacked my mom's, had to leave and remove the eyeball, and she also threatened me. So Mom and I cannot be alone right now. Alright. Alright, I'm gonna look at those results here. Now that I haven't sent to my tablet, I can look at them. Okay. Give me 1 second. Irish.
Mm-hmm.
You wanna help me with the brain surgery?
Do you want me to help you?
I'm a little, I'm gonna need an extra set of hands, yeah.
Yeah, I got you.
I've been a moment.
Max and Gwyn, me and Arabella are going to be doing a surgery, so if you guys can just lock down on the lobby first for a little bit, we'll let you know when we're wrapped up, alright?
Alright, my dear.
Obviously with Ashbrook. Yep, thank you.
Oh?
Any 201s, regardless if it's one, if multiple come up, just go to them there one at a time and stay together,
Sorry,
alright?
radio's obnoxiously loud.
I understand that.
I yelled loud at him because he's the one who was having a full conversation on radio.
Got it.
Oh,
what did
right.
you find?
So what I found, you have a small crack in your skull, and then you also have some fluid buildup in your brain.
Oh, lovely.
That being said, I'm going to see if I can locate exactly where this fluid buildup is. because we have different kinds of lobes. That scan that I took would show me a generalized area, whether it be parietal, occipital, frontal, or temporal lobe. Trying to think of all the names. My brain was just braining for a minute.
Sorry, I had a demon in my head. What?
I'm currently trying to find the location of the fluid buildup. The scans that I took should show me the generalized area in which this fluid is coming from, such as, you know, frontal, temporal, parietal, occipital lobes. Yeah, such as that. It looks like the right side frontal, which would make sense while you're having headaches and a little double vision, so, alright.
Would that also explain why I've gotten at least 2 nosebleeds trying to work on my class assignments?
Yeah.
Okay.
Yeah, okay. Alright, well, I'm gonna have, Octavius, I keep trying to say Nancy. We fired Nancy. Octavius, to get you out of the bed here so we can get you on the stretcher and get you into the, OR.
Okay, I'm letting someone know because they told me to keep them updated.
Yep, I just need you to get out of the bed here. Alright. Are you allergic to anything?
Codeine. That's about it.
Okay, good thing I don't use codeine. I don't like using that. What's your name?
Delta Jones.
Delta? Okay. I can get you on there. Irish, if you could set her up on an IV, get her all prepped and everything, I'm gonna get into my scrubs.
Gotcha. I put a copy of the MRI scan up on the wall there just to reference it if we need it.
Okay, did we do the propofol yet, or would you like me to do that?
I did not do that yet. I didn't know if you wanted to administer more or less depending on the severity of the injury.
Okay, well, we want to have her unconscious.
Okay.
And a little, what was the ruling on Nimbex again? I said there was a ruling on Nimbex.
Was there?
There was, a while ago.
I can't remember. Check the protocol going anyway first. I do think she's out.
Okay.
Just a quick vitals check to see what we're starting with.
Can you talk at least at 50%? Because I can't really hear you in your screen.
Oh, okay, sorry.
You're good.
Better?
Yes.
Gotcha.
I am hiccuping a lot. Sorry.
No, it's grand. No, you're the boss. That's grand.
Right. Yes, I will need Nimbex put in.
Okay.
The thing with Nimbex is it's supposed to be used for brain surgeries to help. It's a paralytic more or less. So when you're messing with the brain, you don't want to hit something and then them jerk and then you slice the brain. You know. So
yeah.
That's what I always think about it. But the ruling was Nimbex is to be used for intubation only. That's why I was confused. But I asked Cookie and Lena, and they were both okay with it. So.
Okay, let's push it.
That being said, we will need to intubate so that we can keep her breathing with the Nimbex. Especially with messing with the brain, it's better to keep her breathing manually versus non. Alright, she's gonna hate me a little bit because I'm gonna have to shave her head.
Alright, intubation's going and the O2's running.
Thank you.
Well.
I'm gonna have to shave a little bit of her head here. Luckily it is a frontal, so it's a little less, but it's also harder to hide. So, I'm gonna go ahead and apply this razor kind of thing, and shave a little area of her head here. Alrighty, I'm gonna need just a second. I feel like I have a feline demon. Madam, can you stop doing that?
And 44 to tree direct.
Go for 40.
Do me a favor. This might be crazy, but I need you to do me a favor. Wipe the call signs off the ambos for me.
Temper.
Thank you.
I'm curious.
As to why?
Yeah.
Did she not attack your mom recently?
Oh no, are you thinking that?
I don't want someone to snoop around and if certain people know, you know, ambiguity.
She did, but my mom's not.
I mean, I welcome my call sign. You can wipe yours, but I'm keeping mine.
I mean, if you want to keep yours, not mine. Probably. Yeah, wipe mine for me.
Yep.
Okay. I'm gonna go ahead and make an incision here on the scalp to access the crack and bleed area. I'm gonna go ahead and pin that skin back. Alright, with that skin pinned back, I'm gonna go ahead and ask you to give me the bone saw.
Okay.
Thank you. Okay.
You want me to suction out the fluid that's leaking out there?
Yes. And the MRI would have been a full body MRI, so I just want to make sure that the only damage was to the brain here. So I am seeing some clear liquid here. Okay. Cracked and okay. See some cracked ribs here. But I don't know if there's any of the ribs
one responding to
like loosened.
in mind, PD is well on scene for that already. Just stage nearby, or take it a bit slower to get there, just so they have time.
Alright. Dahlia just let me know about Nina. Anyway, I'm gonna go ahead and, do the bone saw here, cut a little piece with her.
Yeah?
I've got an individual down at Harmony who was on a race to try and
I'm gonna move you
save
to
himself.
to me, alright?
Down for.
What'd you say?
He
I'm
didn't.
gonna bring the Sam's to with me.
One more time, slower.
You're in Sam's to with me. I just jumped you down so you don't have to
okay.
hear all the chatter. Yeah.
Okay. Thank you.
Gotcha.
This is starting to piss me off. Alright. So I'm gonna go ahead and set this piece of the skull here on this tray. Make sure you put this somewhere where we know where it is, because we need to be able to put it back. Go ahead and suction this.
I'm just gonna put on the tray behind us there.
Yep. Alright, I'm gonna go ahead and try and stint this. Stint this bleed. This one here. Working on this stent a little more because it's gonna need a little finagling. That is rather interesting because I'm pretty sure I would have seen that on the MRI, but you know, it is, our MRI is kind of finicky. There's a little bit of an issue here.
What are you seeing?
She has a little bit of her skull. In her brain.
Okay. Like a lot, or like little pieces, big pieces?
A little piece.
Okay.
Yeah, they're small. Such small pieces. I'm gonna utilize the robot
Okay.
because I am not going to risk anything. The robot's sturdy. My hands are less sturdy than a robot, so.
Nah, no, that's fair. I get you.
You go ahead and grab it real quick.
Cool, you're something.
Grab this, move it over. Alrighty. Alright, sorry about that, little distraction. Alrighty,
Okay.
I'm gonna go ahead and use this robot arm here. Gonna slowly and carefully remove remove these shards that can be removed safely. I'm also going to use the other arm to apply a stint to follow. Where needed.
I'm gonna do a quick
I
vitals check
am
as well.
rather fucking impressed that her vitals were normal-ish. And she was walking.
Well, it is the season of miracles, so.
I am, like, she's a walking miracle at this rate. God damn it, Dr. Octavius. She said, I wanted to get looked over by someone who could do more than the local doctor. I don't know if I can do more than the local doctor, but, you know, I can try. Octavius is kind of a master of all trades.
BP dropped a little bit, but it's going back to normal, it looks like.
That's
yeah, considering what we're doing.
I mean, considering the fact I'm removing something from her brain, her pressure's gonna drop and go back. Alrighty. Right, can I go ahead and grab this other shard? How many shards do we have in here? Oh? Octavius, can we get her back in the bed, please? Thank you. Alrighty, I'm gonna go ahead and remove this shard. Alright, let's see if we have all the shards removed. I have removed 4. Looks like there's 4 shards, so I'm gonna go ahead and check, and so I'm gonna have you section for me. I'm gonna check if there's any excess bleeders.
Gotcha.
Alright, I don't think this stent worked. Let me remove the stent and replace it.
Get that liquid out of the way.
Yep. Dr. Octavius, if you can replace your blood bag, that'd be appreciated. Thank you. Alright, that one's removed and replaced. Let's see if this one holds. I only do one at a time. If I do another one, it's the whole thing. Alright, that one has stopped. Now let me focus on this other one here. Go ahead and focus your section there, and I'm gonna go ahead and stent it. Alright, all the bleeding stopped. I'm gonna go ahead and check and see if there's anything else that we missed here in the brain. Also, if you can add some mannitol to the IV, I'd appreciate that.
Gotcha.
With this, you'll have some swelling. I would say Dr. Octavius, do you think we should do remove the oh god, can I words? Do you think we should replace the bone flap, or do we wait and replace it later? Okay. Dr. Octavius, can we fix her on the bed, please? Alright, I am gonna go ahead and replace this. We're gonna do some bone cement and wiring here.
Mm-hmm.
You good?
I don't know what that was. I'm sorry.
That's fair. Alright, that is on. I'm gonna unpin her skin and suture that. Ow. Antibiotic oil. And there we go. Alrighty. Dr. Octavius, this might be a stupid question, but are we doing ICU or recovery? So the thing with ICU is it's a minimum of 8 hours. So are we still thinking ICU, or do we put her in recovery? She can sleep there for a little bit. Alright. Alright, we're gonna go ahead and get her in recovery. She can sleep there for a bit. Now, I do want to make it known, Dr. Octavius, that she will not be driving anytime soon. And if she is to leave the hospital, she is to leave the hospital in the care of a loved one or friend. Alright, let's go ahead and get her off the bed on the stretcher and get her moved over. Oh god, I know the moment I'm gonna let her go is gonna be horrible. Alright, let's get her unfucked. There we go. Let's get her on this side bed here. Corner bed, side bed, same fucking difference. Alright, I'm gonna apply some erythromycin to here and... At least for the time being, I'm gonna do some morphine.
Okay.
I will have to figure out what to have prescribed to her when she does leave, because obviously she can't take morphine out there.
Mm-hmm.
Alrighty, morphine attached. Alright, oh. Alright, I have a report to write.
Alrighty. Do you want to just do it on like an office or something so you're not getting pestered?
Yeah.
Alright.
I'm still trying to find my energy.
Well, I gotcha.
I'm not as energized as I used to be, and I blame Alex for that.
I won't ask questions.
We're not together anymore. I broke up with her.
Oh shit, I'm sorry.
I mean, kind of deserved, because she straight up, like, the straw that broke the camel's back was telling me that the timing for me to be angry was inconvenient. As if I didn't just, you know, try and search the entire city for my mom, who had been kidnapped by Vivian and stabbed.
Yeah.
Like, You do not tell me my feelings are inconvenient, because that's never okay. That, and I've been getting a lot angrier recently. And not myself, because I used to be very hyper. I do the whole I'm just a blueberry thing, baby talk, kind of just have fun, run around everywhere. Now I just don't do that. You broke my radio.
What do you mean?
I had to turn it off and on again to fucking move channels.
Really?
Yep.
That's weird. Ooh, sorry, I don't know why I just did that. Apologies.
I would have hoped that the local doctor would have messaged the line so we could take care of you, so I just want to make sure that when you were walking there, did you fall or anything?
No, I didn't. I was holding onto the wall.
Okay. Do you have anybody you can call first?
I know my friend Butters was checking where I was, so he might be on his way soon.
He was here already earlier. Yeah.
Yeah, he did say he had to go do a repair.
Well, you're gonna be here till he gets back. That being said, you did have some skull fracture, just some. Oh, I'm gonna put that away. You did have some pieces of your skull. I can words, I promise. Let me just brain refactor reset. Alright, let's try this again. Alright. You had some skull pieces in your brain. There you go. That we had to remove. They did cause some slight bleeds, but we were able to stent them. Do not touch. No, that's bad. Do not touch. We did have to shave a little bit of your hair. Because that's the best way to access the skull fracture, unfortunately. You will be a little sore. You're gonna have a bit of a headache. I am currently looking into a medication to give you because you're allergic to codeine. Need to figure out something to give you for while you're out and about.
Okay.
I'll give you. Do you have specific requests of what not to be given, other than codeine, obviously?
No, my mother pretty much would give me anything that would help. So I don't have any other adverse reactions to anything else. I take it needs to be something stronger than Tylenol or ibuprofen?
Yeah, plus one of those you should not be having with a brain swell / bleed. That can worsen the effect. And you are gonna have some rather horrible pain. So you're currently on morphine right now, but I can't give you a pill version of morphine. So I'm gonna give you something that you can take once a day. Or, as needed, so if you need to take it twice a day, you can. At least for the next week.
Take it I'll need to come in for another checkup afterwards?
Yes.
Okay.
I am going to be making a message real quick to my mom to assist me with the medication to be able to give you, as I am a little on the not so knowledgeable side of medications when it comes to brain stuff. She is a neurologist, so.
Oh, you also have a doctor for a mom.
Who's yours?
She works in another city. My mom's name is Stephanie.
You can tell Butters he can come back here. You are in recovery after all.
I let him know.
I'm just awaiting a response from my mom. At least for the next couple of days, I will not be having you drive, especially on the medication that I potentially give you. Might be best not to drive on. So you will be a passenger princess for a little bit.
Okay, I was already kind of banned from my fast cars anyways.
Honestly fair. Give me just a minute to get a response and I can get you a prescription.
Okay.
Hey, Butters.
Hey there.
Hey,
How's it going, mate?
good.
Echo 44.
So I'm gonna guess you can't drive for a while?
Carter Scott asking about Nina Weiss and if we have seen her. I said we're not gonna tell him. But if we have.
Who?
Dante Carter Scott used to work here. Went by Dante Scott.
Should know better.
Yeah, no, but he's a moron.
You said it, not me.
I can say it. He's standing next to me.
All right, 10 tree.
Hello. How are you doing there, Bella?
I'm doing.
You're doing? What does that mean?
I'd rather not go into detail.
How have you been feeling lately when you've been on duty? How have things been for you?
Slowly getting better, trying to work on it. Just trying to get back into the swing of things one at a time, you know, small shifts.
Mm-hmm. When you say things are improving from what?
From at least a couple days ago, at least. Maybe not days ago, but like week. I don't know. My days are kind of mixed. I
What was going on? What was going on there?
just feeling. What's the word? Can't think of the word. Unmotivated.
Okay. In what way? Like unmotivated to work, unmotivated to... In what way?
I don't really know how to clarify, personally. It's one of those things where it's really hard to explain because there's not actual words to put to it.
Okay. How do you feel about your rank as a senior doctor, I guess, attending now?
One more time?
How do you feel about your position in SAMS right now as a senior doctor attending now?
While you were saying that, Irish texted me and the noise drowned out your voice. Silent that real quick. I'm gonna... Okay, see if I can hear you now.
How do you feel about your current rank, your position in SAMS as a senior doctor?
I feel like there's not much of a difference. Like, I try to help out where I can and everything, because, you know, being an FTO and everything. I want to be able to help out a little more, but kind of limited on things that I can do. Slowly trying to kind of inch my way into helping more in things that I can put my hands into, you know? Being non-supervisoral, that is. I was helping in interviews beforehand just by, you know, being there, watching and everything, and then I haven't. That was like months ago, to be fair.
Okay. I know you had requested to become ME certed. Have you gotten to sit in on any autopsies lately?
I am trying to. I did show up originally to one, but my motivation, as soon as I was there and everything, just so much stuff was happening all at once that I got extremely overwhelmed and I had to basically step away, and I let Phoenix kind of just take over and everything, and I did step out because I felt like in that situation I would have not been able to work at my 100%. And I had clocked off.
Okay, when you say there were a lot of things going on, was it things happening on duty or elsewhere?
Kind of both, but there was a situation with PD apparently having a active situation, but we were not made aware of it because I quote from Chase, we were told that there was no EMS on duty, which, okay, I understand that. The thing is, we had been on duty when the call came in. We showed up, we've been showing up to calls for a little bit, which just tells me that PD didn't act, well, whoever PD was at that time didn't look to see if we were on duty. That was a little upsetting. But I think that kind of just, like, put it at the peak of, like, I can't work at my 100% right now. It's best I clock off so I don't make a mistake.
Okay. Would you say you can handle high-stress situations well?
For the most part, I have actually been working on trying to separate my professional and personal recently. It's a little hard to do, but it is something I have tried to do and I've slowly been doing pretty well with. Trying to learn a page from Lena's book.
Mm-hmm. So I will say that is something I have been keeping my eye on, because I will just be blunt honest with you, Arabella. I have noticed that when things get a little bit more stressful, or you might come across a more complicated patient, whether that be personality-wise or, well, I guess more so personality-wise, I have noticed a bit of an issue with your attitude and bedside manner. I get, we come across some people who are not the best to work with. However, especially once we start getting into ranks of, senior doctor and above, there is a certain level of professionalism that I expect from people. And I'm going to be honest, I have not really seen much of a change from you. I have even had PD come to me and tell me that you have been showing them that same attitude, which I cannot have. I gave it some grace because you were gone for about 2 months, and I understand that takes some time to come back, get acclimated to things. That's perfectly fine. But during that time, all I've been hearing is people coming to me about your attitude, or you saying that you were just unhappy with how we were running things, and it really just hasn't been
what
much of an optimistic attitude. I guess specifically, I've been told that you are unhappy with the choices that we have made with our leadership in the hospital. More so because you believe that you deserve a promotion.
No. Those words have never come out of my mouth.
Okay, so you didn't come back to the hospital literally your first week and say that you disagreed with all of my supervisor choices?
I don't disagree with all of your supervisor choices. Yes, I have disagreements, but doesn't mean I'm going to, treat them any differently or anything. I don't have to agree with your decisions on them. Just, as long as I listen to, my supervisors and everything, which I do. Because I don't like everybody. I don't have to like everybody. At the end of the day, as long as I treat them with respect and, like another human being.
And that's the issue. I don't need people to agree with anything I do. I don't care. I like pushback, but it's the fact that if you don't disagree, don't show it. There has not been actually any level of respect that I have seen since your time back.
What the fuck?
And I understand, you might not want to own up to that, but I have been being told for months from multiple people that this is what they've seen. And it's not just within SAMS, it's in PD as well. It's from patient. So at this point, I can't turn a blind eye any further. I am going to have to demote you back to a resident doctor.
Fine. Just do it.
Okay. Is there anything else you would like to say?
Nope.
And respond?
Nope. Just do it.
Dahlia, is there anything else you want to add? Okay. Well, thank you, everybody. I'll be making a change to the roster.
Echo 30 is going to go 42 for food.
Sure.
10-4.
Echo
Service.
42. Echo 46 is 1042.
Free service.
What?
Arabella, unfortunately, due to that reaction to that, I'm gonna need you to clean out your locker and bring your badge into the office.
Are you serious right now? I thought you were done.
I mean, we talked about the attitude, and then you immediately continue
Because
to
you
prove
just
me right.
demoted me when I've been trying to work my ass off.
I'm sorry.
I needed a clock off duty because it was... I needed a clock off duty because I've been dealing with a lot of shit that you don't know about. Because I don't tell people about it. I know Dahlia probably knows about this, but I broke up with Alex today. or no, today, this week, something like that. There's a lot of shit going on. I needed to clock off because so much shit is going downhill for me.
I understand that.
Just give me a chance to I'll take a couple days off, even a week off, but I need to breathe. I need to have a break from everything. Being a doctor is my life. It's who I am.
Okay. I'm going to give you a week.
Okay.
Take some time, cool off. I'm going to expect to see some real change, Arabella.
Okay.
Alright.
Sorry.
Arabella, we could use assistance we're in a few months.
You're where, sorry?
Lower.
10-5. I'll wait for you.
Thank you.
PD?
Found that.
Scene's not currently clear in the tunnels. Is there a way we can bring them out and you guys have a point where we can bring them to?
10-4, we're in the parking lot that's behind PAC. Behind me used to be a nightclub off of Clinton and
Okay, we're gonna have around 4 suspects and about 3 or 4 officers, I believe.
413 Alpha so far.
10-4.
Okay.
Hey, Firm, what's their conditions? Any criticals or non-criticals?
Well, the one I've treated, Richard Wayne,
Basically
he's
all
gonna
hands
have
on
2
deck. I
GSWs
am
lodged
just
in his
not fully
chest.
confident doing that by myself yet.
That is
I'm currently just looking over
fine,
Novak
Now,
right now.
That being said, whenever we're done with this, we're gonna
10-4.
fix
If we can get them triaged to know who's critical and who's not, and we can start shuttle busing them.
Yeah, copy. You're all good?
4 suspects, 5
656, 588.
5 officers?
I saw 4, but I
4.
could miss one.
That's okay.
So
those
we're
are the
4-4
same
at the
person.
moment.
Same person. Is it 555 the same? Oh yeah, that's because I only see one. Never mind.
I heard 4 officers, 4 victims, right? Or 4 suspects.
To start, I don't know that there's any cops left standing in those tunnels after Bradford.
I'm going to let you know if we do get Richard Wayne. Make sure they double check that his cuffs are secure. Last time he ran out.
Scene is code 4. You guys can roll in if it's easier for you guys.
So we don't help anyone with their feet
I'm grabbing another bus and then
yes.
Copy. Come on, guys, to
If
move them
it
out of
is
the cars. So
okay,
it's easier for you
I
guys.
do not feel comfortable treating Mr. Wayne at this point.
Okay,
That
I'll
is
hand him
perfectly
Mr. Wayne.
If Echo 1-2 is
If you
rolling in.
wanna take care of some of the officers, then we can prioritize that. Is there anything you're not comfortable with specifically, other than
It's just that I have only assisted with 2 surgeries at this point, and I help sutures. Yes, I help sutures.
Yeah, 3 out that can hold 3 each right now.
I say this afternoon, one time, so
should be okay, but I will
I'm still
come
in
back.
like a shadowing phase, if that makes sense.
if you're able to take care of officers that just need a little patch up, suturing and all that,
Yes.
then I'll have you do that, and then I can take care of the bigger ones, and then I can have you join me if I need extra help.
Yes, I can do that. It's also like I would just probably be asking some clarifying questions.
That's perfectly fine. Like, if you're more comfortable taking care of, like, through and throughs and stuff, just make sure.
Yes, I did one this afternoon with some shadowing from Onyx, but I think I can at least do...
When did we get green on our beds?
Oh, Octavius has been painting them. It's also in the recovery upstairs.
Through our entire hospital and see what I am missing, 'cause
Yeah, there's a lot you're missing, actually.
Yeah.
I mean, even right there.
Yeah, I'm gonna have to go through the entire hospital when this is done, just, sightsee.
Also, is everybody sufficient on the
food and drink?
medkits and
First aid kits and bandages, yeah.
Yes.
Yep, I got 10, 15.
Okay, I
Yeah,
might need to grab some extra really quick. I'm sorry. I'll be right back.
You're good. We got time.
Oh god, hiccups.
Okay, so all suspects down in this space. We're gonna have overflow, so somebody's gonna have to go upstairs for any officers, assuming all 8 patients decide they're gonna go to a bed.
Yeah. I would say, focus on getting the 95s down here, because knowing them, they're going to try and run. They go up there.
Yep.
Seen it before. With these specific people, that is.
Not surprised.
Yeah, me either. I am going to check something real quick.
Hey, Athena. When the suspects come in for their wounds, we're going to keep them all downstairs. If doctors need medical or police need medical care, we're going to send them upstairs.
10-4, because we actually have enough units to be able to split that, huh?
Yes, we do. And if we're prepared early, then we can handle everything effectively versus scrambling last second.
10-4.
Just keep an eye on lower room 5 in case the patient gets brought down by the doctors.
Okay.
Good to know.
Maybe? Hold on.
Okay, so it'd be sufficient now. I got 10 medkits and 15 bandages.
Cool. All right, well, we're definitely getting you signed off on GSWs today.
Yeah, so the thing that I've done so far is assist during the operations.
Jeff, is that 95 or PD going into your car?
Mostly like check vitals, did like
10-4.
cuts,
All right,
bruises,
hold on there for a second. I might give
stripes.
you Novak to bring over for me.
Okay,
Alright.
so I don't know
And
if
then
this
one
patient
GSD
is
here.
going to wake up, to be fair, because they have been in there since May of this year, so I doubt they're going to.
May?
Yeah,
I don't think they're waking up.
I don't think they're waking up. So I don't think we actually have to pay attention to that. Oh. Yep, they're in a coma, it seems. Updated 2 months ago. Okay.
Do you guys have room for one more to ride passenger in that Ambo? Ruiz is not super critical, but she could become critical.
Who are we assigning upstairs for the officers? Do you want me to go up there or stay down here?
If they're critical, they should stay down here. If they're non-critical, they should go up there. Are you confident there, Jane, at all? Or...
that is completely new field for me, so no.
For upstairs,
if you don't want to be around
GSWs?
Mr. Wayne, that might be the better place.
Yeah, that's what I was
And it's
suggesting.
going to be less chaotic.
Because if there's officers getting sent upstairs, they're going to be likely the less critical ones. And if you need help, we're on
Okay.
radio. We can help you.
That's true. Then yes, I can do that. That's fine. Sorry, I got a little bit mixed up.
Echo 1-2 is 76 to upper pillbox with 3 47s, 2 critical, 1 semi-critical.
Yeah, I'll go assist
Jen,
them.
are those individuals going to be PD or 95s?
They will be PD.
10-4.
66 will be able to assist.
One semi-critical. I think it'll... What justifies as semi-critical?
I guess we'll find out.
They're shot and hurting, but not unconscious or dead.
Likely awake and talking.
Yeah.
That's how I take that. Why are they upstairs?
Because I've instructed PD to go upstairs, and criminals are going to come down here with other officers, so it can be better managed.
Okay, but she went upstairs because she thought that it was non-criticals.
Yeah, I'll...
The non-criticals should be coming down here.
I'm gonna have the non-criticals being upstairs, and anybody who is critical, including PD, be downstairs. Unless they are 95s, they stay downstairs. What is the status of the non-critical one? Excuse me, the semi-critical one.
10-9?
Conscious, breathing. They are packed and on painkillers, I believe.
She got TXA and fluids, bilateral IVs. I put her semi-critical because she had a lot of bleeding on scene. Her blood pressure was low.
Which one's a semi-critical? I'll take care of her.
Ruiz.
10-4.
I cannot seem to get anybody out of the ambulance. There's two in there.
You know how to take them out?
ETA on the ones on scene.
Oh. Try it by the door. No, the other door. This one.
You guys need a hand?
Oh, this one, sorry.
Yeah. We would love one if you can help us try and get people out, because I can't seem to get them out.
Hold on. Okay, get away.
Oh, I got one.
Dana, can you give us a heads up when you're on
This
your
is
way?
gonna be a non-critical.
10-4, I'm gonna assess all the 95s, and there's one non.
I'm gonna.
No, that's not what I wanted.
Do you have any more criticals or 95s who need to be brought to pillbox for treatment, or?
There you go.
Alright. Sorry, I had problems getting them out of the ammo.
Hey June, I'm gonna have you leave the premises for now.
Okay.
For safety reasons. Thank you, dear. Wait, where did we get shot, Ruiz? What the f-
Advise Echo Tree is going to 76 back to pillbox with 2 patients, 195 and 1 PD.
Everywhere. Okay, I'm gonna go ahead
Copy, you have an officer accompanying you that can hold down the
okay,
Lord.
apparently that doesn't work.
A-firm, I have someone following.
Okay, well.
I'm trying.
It's fine, it's fine.
Oh. Athena says she packed me. I don't know, man.
Yep. And I mean, it does look like you got some packing. I'm gonna go ahead and do a little scan here, see if we or ultrasound here. Excuse me, I'm gonna have to look at that one more time. Okay. Looks like you got a superficial one here. It is a little loose. I'm gonna go ahead and carefully remove that one. And then I'm gonna do some lidocaine to numb it up so you don't have to feel it.
Tree's just passing up on Strawberry Avenue. Be advised they'll be there in T-minus 30 seconds.
Taken care of. If not, we're just gonna lidocaine suture you and you'll be all good. I am also gonna check your vitals. Dr. Octavius, can you help me checking your vitals? It's clear.
Alright, Athena is gonna be 76, 295s, non-critical. Some through and throughs I can suture up.
Okay, so I don't see anything really internally other than a couple like blood vessels that'll heal, you know. Non-pertinent blood vessels that'll heal.
Okay.
I am gonna numb it up. I'm gonna get you all sutured up. What'd you get shot with? You don't have any allergies, do you, Ruiz?
None to my knowledge. Or actually, no, I'm allergic to bullshit.
That's fair. Alright, I'm gonna go. This one's gonna be numbed up. You wanna tell me if you feel this? I'm tapping it right here.
Just some pressure, but not.
Perfect. Alright, I'm going to carefully... Dr. Octavius, I'm gonna need you to follow me with suction, just in case, with this bullet hole. Go ahead and remove this surface level bullet.
Tree dispatch, do we have any more people on scene that need medical treatment, or are we 10-4 up there?
I believe I took the last two.
Firm.
How does it look? If there's any more bleeding happened. Yes, that was what I was gonna check. I wasn't sure if they had added blood, so I wasn't gonna instruct yet. I'm just making sure that this one here is not bleeding any more than it needs to be. Thank you. She said she added painkillers. And saline, so we're good with that. Just make sure the saline bag is still somewhat full. Suture this one up. Alright, see how many GSWs we have here.
Tree to dispatch, be advised, if you have an ambulance unit parked in lower, you are going to park that into our fleet afterwards. We have units upside.
10-4.
There's 3 wounds. I got the one on the side here sutured up. We're gonna... For Dr. Octavius, I would like you to follow with antibiotic and bandages for me. Thank you. Gonna do some lidocaine to this area. It might just be a little hard to breathe due to the pain of impact, but I'm not seeing any internal organs or any other damages other than, you know, just main musculars, which will heal on its own. Alrighty. Oh, so that one. Alright, and then last one here. This one as well. Alrighty. I'm just gonna give you one more look over, make sure we're not missing anything, and then if not, we'll just move you over to recovery. Alrighty. Go ahead and get you moved onto the stretcher here. That is a very low-hanging light. Hello. Oh god.
What?
You're so green, you know? I'm gonna put you in the green bed. It threw me off. Apparently last night, Dr. Octavius and some of the other doctors decided they wanted to decorate, so I guess they wanted to make everything green and blue. Although the blue should probably change to red for Christmas. Alrighty.
Looks like the sheets are missing on this one.
You have sheets. They're just, they're the silk sheets.
Oh.
They got a bit of shine to them. It's just missing the top sheet.
Oh, okay.
Alright, I'm gonna go ahead and hang your IV up here. Whenever you are ready to go, Dr. Octavius will remove your IV. I am assuming you guys are gonna want and need reports, medical reports.
Yeah.
Alright.
Yeah.
Okay. I'm gonna write down names. Hold on. Alrighty. I will go let them know. It has been requested that even if an individual just needs a suturing, to write a medical report.
Hey, phone.
Anybody need extra hands?
I'm code for my patient.
We're code for in here.
Sorry, how's Navak
Code
doing?
for Maze.
I'm working on her DSW. She is for lodged in the draft.
Okay. Once I'm done here, if you need assistance, let me know.
For the moment, I'm taking
Everyone good downstairs?
10-4. Am I needed upstairs? Do we need people upstairs?
Negative.
10-4. We're code 4 downstairs too.
Alright, I have a free pair of hands if anybody ends up needing them.
10-4.
Don't worry, I thought so too. Okay, so shit went down. We lost like all of High Command yesterday. So we're now doing a whole rebranding, I guess.
Oh, wow.
Yeah. Only one High Command stayed, and he is now the director.
Wonderful.
Yeah.
We love rebranding.
I'm not going to. I don't love rebranding, solely because the last time we rebranded, fucking SAO wanted to throw malfeasance around like it's fucking candy.
Ooh, malfeasance is so much fun, though.
Not when you get charged with it for getting tortured and knowing that somebody got shot a certain place and getting blamed for reading their report when I was there and watched him get shot. I know he was shot there because I watched it.
Yep, exactly.
But, you know, they tried charging me with malfeasance, so.
Hey Shams, this is 588. Thank you guys for your amazing work. You guys were fucking amazing.
Yeah, 10-4 anytime.
Broford, quick question for your brother.
Yes, go for it.
All of our incident reports, who's going to be receiving the copies of those from you guys?
I mean,
Flood my emails. That'd be fine.
Almost charging
10-4, you heard the man. Broford gets your copies.
Hold on.
Thank you guys. Love you all.
Radio's going off.
Thank you.
Alright, what'd you say?
Imagine almost getting felony trespassing for doing your job.
What? I feel like I need a story time.
Imagine if he called you up to the prison because someone is injured, and then you arrive, and then the warden's like, "You are not allowed in my prison. I'm going to charge you with felony trespassing for coming on my property."
Yeah, no. That's not how that works. You're there to do your job. You're there to do your damn job and leave. It would be trespassing if you stay. Anyway. You didn't get charged with it though, right?
No. Luckily not.
Let's begin.
Hello. That is Irish, our director now. If you ever want a job, we're hiring.
Can I cut people's body parts off?
No.
Okay.
Unless they need a medical amputation with an actual medical necessity. Why is that a question, Bella?
What?
Why did you ask that?
Because I spent too much time with crazy people.
No, I want to argue with that, but you know, you're not wrong. Anyway, I was telling you because I didn't want to be out there. Let's go back out there now. You just chilling?
Yeah.
I barely see you anymore.
I know, right?
I'm the look at he's got the ass plug too.
You Lucy Jr.
Wait, no way. Sit around, Joe.
Yeah. Epilepsy type shit. I can get you the doctor's note if you need, but it's
No, you're good.
back
You're
at home.
good. You're photosensitive. Is there specific things that trigger it other than lights?
It is mostly just bright flashing lights.
Hello.
Oh.
Like fucking thunderstorms render me fucking useless. I had to fucking put my head
That's fair.
between my knees and hope for the best.
That is fair. Being said, I got this here. Okay. Do you have any emergency contacts?
Not currently. I literally just moved there yesterday. I moved back yesterday, I should say.
Okay. You have the epileptic. What's your blood type?
I haven't had that tested actually, and I can't remember what it is. Have you got any like those like blood testing kits or anything?
Come with me. We're gonna go to one of our diagnostics rooms.
Okay.
Well, our diagnostic room, because we only have one that we can use. The other one is the plastic surgery room.
So you promise you're not a vampire?
I promise I'm not a vampire. I wouldn't even be
Okay,
able to
good,
be one if I
'cause-
wanted to.
Well, I don't know. You could be trying to trick me, you know?
No, I legitimately
Hospital.
have the rarest blood type in the world, which means I will literally die if I don't receive RH null blood.
Oh, Jesus Christ.
Yeah, it'll feel like my veins are on fire. And if I don't get on hemodialysis immediately, I can literally die. It's lovely. So any allergies? Can do that at least.
Not that I'm aware of. I mean, I do get a little bit sniffly around, like dogs and cats, but not like, you know.
I will notate that as minor to dogs and cats.
Okay, sounds good.
Alrighty, we can go ahead. Let me go ahead and grab this. My phone is reacting to my mic. Alright, I have this. It's gonna do a little finger prick, so you're gonna have to take your gloves off.
Alright, yeah, hold on. There we go.
Okay, I'm gonna go ahead and do this prick.
Oh, Jesus Christ.
Oh, alright. Go ahead and... little sample thing here. I'll give it just about 2 minutes to learn the blood type here.
Okay. Oh, I was told there was a cafe around here. Do you know if they're still open or are they closed for the night?
I think he's closed right now. Usually if they're open, they will have like a thing on the map, which I don't even know how to explain it. It looks like a church, kind of.
I'll get you.
Alright, looks like you have a B negative blood type.
I mean, what, you calling me pessimistic or?
No, it's literally your blood type is B negative.
Oh, right, okay.
It's matching.
Keep having people telling me to be more positive, so, you know.
Yeah, I don't know. That's all I have. If there's anything else you can think of to add, I can do that. Otherwise, I would suggest talking to the government about getting your gender changed.
Yeah.
People might see that and make fun of you, I'm not gonna lie.
They're gonna, I mean...
Jump
they
for
can
me?
try as much as they might. I knew I shouldn't have let him fill out the paperwork, Jesus.
He's back. Bella.
Welcome to Pillbox. Free ketamine in the back room.
Bella?
That's not true.
Bella?
Tell him about the orgy bathroom, Bella. Tell him about the orgy bathroom.
I'm learning.
No orgies, no free drugs.
We got 17 people in that bathroom one night. It's crazy.
Welcome to Pillbox. You stop them, we beg
Bella,
them.
shush. Bella. Bella.
What?
No. We don't do this. No, we don't tell people that there's free drugs in the hospital. We don't do this. There's not free drugs in the hospital.
They don't know that.
But they will go looking for it if they have drug-seeking behaviors.
Okay, free DNR bracelets.
Don't do that. People aren't going to understand what that means. That's illegal.
I'll tell them they're gold-plated.
That's a legal thing that can actually get that can actually get you a huge charge for doing that, girl. That's a medical neutrality thing. Let's not do that. Like, let's be nice. That's not what the fuck is. I'm not gonna question it. Baby's not a good influence. Just saying.
Oh, he was trading me.
No, do not listen to him. Do not
He's
listen to
trading
Baby.
me to be the best breeder here.
He is training you to do something illegal. He is a criminal.
Oh.
He is a known criminal who has murdered people.
Well, I did. Wait, what?
Yep. No, Bella, don't make me steal you. Don't make me grab you again.
Oh.
Bella.
There you go.
But more aggressively.
I got you.
On gloves. Thank you.
I got you bear.
Thank you so much,
There you go.
baby.
You're welcome. You're welcome.
I will put you in timeout, which
You're welcome.
sounds very weird to say.
Hey, yo, can I be next?
I'm gonna put this in my locker where it's safe and sound, okay?
Alright, sounds good, yeah.
Once I have my beans, I'm happy.
Maybe.
Don't threaten me with a good time.
I swear you only got married like 2 weeks ago.
Your boy?
What is this, an open fucking marriage?
Oh yeah, that marriage I didn't get back to, huh? Bitches.
And I'm not with my fiance anymore, so it's fine.
Wait, what?
Damn, but I'm married. Oh shit, let me take this ring off real quick.
Don't throw it in my beans. I don't want to choke on my
I
beans.
broke up with my fiance because she straight up told me to my face, the timing for my feelings was irrelevant, or, what was it? It was inconvenient.
What? Why?
As
What
if,
the
you know,
fuck?
me having feelings
Huh?
is inconvenient to people.
Oh no, now I gotta
Wow.
listen to this. What the fuck?
Yep. After me putting aside my feelings for as long as I could to make her feel better, she said that my feelings were inconvenient.
Honestly, I don't
That's
mind it.
disgusting. That's gross. I can treat you better. Fuck, I have a husband. I gotta go. Gotta move.
Don't worry, I turned.
Hey, I'm open to
husbands.
flirting
Over
anytime.
there. The Azure brother. I turn deaf when needs be.
Boys are bad news.
Mm-hmm.
What?
Boys are bad news.
Unless your name is Irish.
It wasn't a boy.
Definitely
it was a
not.
girl.
Yeah, well, me with boys are bad ideas.
You also know me with your son was.
Yeah.
Yeah, that was
He takes after his father.
Uh-oh, what happened this time?
No,
I don't
it's
know.
Not. It is not.
Well,
you said he takes
You know,
after his father.
his father's just crazy. And you know, he his
Not
BFF's
go
with his
dream about
dad.
being a narc, you fucking narc.
He's a daddy's boy.
That is true. That is true.
Just like that, he runs to the airport.
There goes my hero.
Oh, Irish was your hero.
She has a boy as her hero. That's what her mistake is.
I'm sorry. Just whenever I look at Irish, I just go, oof, it should be illegal to look that good. Oh my god.
Oh, that's just a look at the Irish.
It's okay. I have my granddaughter. That's good enough for me.
Yeah. I'm gonna go drool over Irish again. I'm gonna go over here.
Even though my granddaughter has had to save my ass twice in the last 24 hours.
Wait, who? Rachel?
Rachel. Yeah.
What'd you get yourself into?
Well, she had to go to a call, so she left me in Legion.
Okay, well, yeah, there's that mistake. I mean, that's kind of...
Yeah.
Okay.
So yeah, that explains both times.
That sounds fair. Legion is like a death trap waiting to happen. I can't even blame you on that one.
That's why she told me to come here. She's like, I'm safe here.
For the most part.
How can we help you?
Can I get an ice pack?
Yeah, I can do that. Sorry, I just got really close to you. I'm so sorry.
It's okay. Don't worry.
I apparently don't know personal space today.
That's what I want.
What happened?
Oh, local decided to hit me with a car.
God damn it, locals. Did you yell at them?
I did not. I probably should have.
What's hurting you?
Mostly my leg, honestly.
Mostly your leg? I'll look over this for you. Did you feel or hear anything snap, crackle, pop like a Rice Krispie treat?
I did not.
Okay, that's a good thing. Are you having any numbness or tingling in your legs? Or your back?
No.
Okay.
Luckily not.
Alright, I do see some bruising, just some light bruising here, so I'm gonna go ahead and apply an ice pack. I'm also gonna give you some bruise balm and it'll help with the healing of the bruise itself.
First ambulance is outside, they just got rammed to shit.
Thank you very much.
Oh, good. Mate.
Thank you very much.
I'm gonna go check on the ambulances.
I don't think it belongs over there.
Huh?
I don't think that car belongs over there. Let's see what other cars we have.
Yeah, I'll go get a feed.
Who rammed it?
Oh my god, look, it's glowing.
But it is!
See? It's dark enough you can see it.
I want my teddy bear.
You want Christmas sweaters?
I want
There's some in the locker room.
I know, but I like my coat.
Yeah, that's fair.
I was told that at some point we might get teddy bear scrubs, and I can't wait because it's my
That's gonna be a bit. Not super long, but a bit.
I know it'll be a bit, but when it is, I will be rocking the shit out of those teddy bears.
That's fair.
Yeah,
Hello.
Oh, howdy.
Let's go over here.
Oh, thank you.
What happened?
Huh? Oh, I may have took a little bit of a hit a bump in the road and hit a side rail with my hip.
Did you feel it like anything may have dislocated? Any snap, crackle pops like Rice Krispie? Anything like that?
Oh, my hip kind of popped, but I popped it back. I think the first time that's happened. But it's a little sore as always. Things ain't supposed to go that way.
Yeah. I'm gonna give you this ice pack, get you a little cleanup here. Do you want me to get a little scan, make sure nothing's of damage? I don't have to, but I can.
I mean, I feel fine. If you think it's necessary, go right ahead.
It's all about your comfortability.
I am prone to injury, but I think I'm all right.
Well, if you think you're all right, and you know your own body.
Hey, we've met before, ain't we?
I'm not sure.
I'm not sure either. My name's Zane Cruz. My friends call me Crash Test.
I don't think so.
Trying to. Maybe I just remember somebody else with that pretty hair and a flower crown. That's probably it.
Given Indy Rose has brown hair and a flower crown, and everybody keeps calling me her, probably.
Indy. Yeah, that could be it.
Yeah, figured.
Apologies if that's a common mistake.
No, don't worry. Everybody calls me Indy Rose, not Indy Timu, Indy.
Well, how's it? What's your name?
Arabella.
Arabella?
Yep.
Well, it's good to meet you, Arabella. I
You
can't
as well.
promise you I'm going to remember your name because I can barely remember anybody's name.
That is fair.
But I will give it my level best.
Did you find any hee hee ha ha posters downstairs?
Oh dear God, it's baby. Let's see if he's got more.
Please, they're passing away.
Squeak, squeak.
Oh my God.
I'm leaking.
Stop it, let her get shot.
I didn't get shot. I got ran over by a car.
I got ran over by a car too.
Usually leaking is somebody bleeding from a bullet hole, but getting run over by a car is a little more concerning. What kind of car? How fast were they going? And
Not fast. Small car. Compact, some might say.
All right, let's take a look at you here.
did you feel or hear any snap, crackle, pops like our ass?
You feel anything snap, crackle, or pop whenever it happened?
No.
Okay.
They were mainly laughing at me, so I don't know.
No, you don't want to hear that. That means something.
Maybe.
Broke. So
Yeah.
that's a good sign. Can you tell me what hurts more than anything else?
No.
So,
Can I let you get out of the bed here so I can actually get you?
Yeah.
Not gonna
Can't
lie.
believe Baby ran you both
I was
over.
gonna say, what did we learn about getting out of the car with Baby Matthew?
Why did you chase Baby? Why are you here with us?
Because you two.
Oh, we're chasing Baby too.
We're still chasing.
But you guys are also under arrest.
Did you leave Bobby alone? You shouldn't have done that. You shouldn't have done that. Ow, 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 ow.
It's okay. It's okay.
Looking over your injuries.
They all.
I'm gonna apply some betadine to this.
What's Benadine? Is
They all
that
robbed
like
the store, Rachel?
a citrus?
No, it's
And they all robbed the store.
So it's
Oh.
They were all inside the store, yeah. The only one I saw actively
Squeak,
messing with the safe was
squeak,
Squeak, over there.
squeak.
But he was behind the counter. And when after I
You
walked
have
in,
such
he walked
soft hands.
Sounds like they acted as a group and then evaded.
Yeah, I know.
Clean this up. Antibiotic.
We'll give them both robbery and evading.
Oh, hey Rose, you want to see something funny?
Sure.
Squeak, squeak.
Nice. Helmet certified?
I had to get on the bike yesterday. Yeah, I got forced on the bike.
Absolutely.
Oh, thanks.
Get your helmet certification from Bobby.
Much better than getting
Kevin,
ran
you
over
gonna
by a
live?
car. No, I'm gonna die.
All right.
I'm gonna die.
You die?
About ready to help her up.
I'm gonna die, right, Doc? I'm gonna die.
He's gonna live.
Squeak.
Are you gonna run from me?
Squeak.
Yeah, she'll.
Look over any of the old wounds, see what we're looking at. Probably be able to get you a change of clothes. Something you're probably feeling a little more comfortable in.
Yeah. Okay.
Be able to get you a bed there. Then grab this little I'm gonna do a full panel of tests. I'm gonna do some X-rays here in this one, then we're gonna move you over to that one to do CT.
Okay.
Okay.
Um,
Tell me what to do.
Yep. Just lay extremely still. And 1, 2, 3. I'm gonna press the button. Take a picture of your bones. Boop. Alright.
Running this one more or less to keep it, see how your skull that is doing.
Mm-hmm.
Okay. I'm gonna go ahead and move you over to the other one. Switch to the stretcher. Miss Vega. Okay, I'm gonna take. Actually, I don't think you have any metal on you. So we'll be good. I'm gonna go ahead. Yeah, I'm gonna do color contrast. It's gonna make you feel like you're peeing, you're not. Alrighty. Be right out here, okay? This one is gonna be loud, so there's a set of earbuds right here. I'm gonna go ahead and put these right here.
Okay,
Ranger! What?
It's like, where's, like, is that the thing I'm hearing you from? I don't know what.
I mean, that's why I
earbuds-
put them on your ear.
Oh, okay. I thought you were handing them to me. That's why I was.
No, you're good. I put them on your ear because I realized you probably wouldn't. Merry Christmas. Hey, Ranger. Misty is a trooper. Oh, she's a cadet, but. I'm sad that I don't get to work alongside you. Scan is done. I know it's a little loud, but... Alright, we can go ahead and get you back to the... would you like to get into something more comfortable? Esper.
Yes. Sorry. I think my the lady next to me was trying to talk, but we can wait on that, I think.
Lady next to you?
Yeah, this like it's semi-invisible lady that I was trying to calm me down before you came in.
Oh, Nancy. Oh. Lisa. It would have been Lisa, because Nancy was fired.
You know how many times Nancy has been fired?
Nancy was fired, and we have Dr. Ophelia, of the Octave... Dr. Oct.
Doc Ock? Yeah, no, it's... no.
Gonna go ahead and get you out of the bed here, okay? I'm gonna go ahead and get you a set of clothes that you might be more comfortable in. are also at some point going to have to do a blood test to make sure your nutrients in your blood is all clear of any kind of foreign substances. I'm still looking at these tests, by the way. And if Lisa needs to email them to me, that is perfectly fine too. Onyx, are you seeing any of these results? I'm not.
Looks like there is a fracture on the X-ray. In the skull.
Okay.
Yeah. Is that on the left or the right side? And to the back or the front of the skull? Left front side. Okay.
Or temporal or frontal?
Well, left front, so...
Could be both. Could be one, could be the other.
It's more the side of the head and not, if it's more like, say where her temple is, more than like the top of her skull, it could be temporal.
Temporal? Okay, temporal does go into frontal. It all depends on like, what part of, how far forward it is.
Right,
I'm gonna have to see that CT one more time, sorry.
Thalamus and frontal lobe. So, there's damage to a bunch of places.
Okay,
there.
What kind of damage are we looking at? We're talking about scarring, we're talking about lesions. Shouldn't be any swelling given she's been on mannitol.
Yeah.
Lesions will have to be taken care of.
Yeah.
Scarring, we're gonna have to try oxygen therapy to try and get those to go away. If those don't work, there's other methods we could do. But I always want to go for minimally invasive first.
Sounds good.
Okay, ma'am, can you hear me? All right, let's get bilateral IVs going. Let's hook them up to monitors in O2.
Sorry.
I will be just, I'll be able to listen to you, but I won't be able to respond for a little bit. So I'll just do what you ask me, okay? I'll be of assistance.
Okay. Alright, see through and through on the thigh. Check if there aren't any more. I see one lodged in the hip from the looks of it. I don't see an exit wound. Okay. Let's start sedation on the paralytic. Let's get her intubated. Let's get FFP, TXA, lidocaine, epi, dopamine, a massive transfusion protocol, and an unit of ONAG. I'm going to start on the hip. See where this bullet is lodged exactly, if it hit anything on the way in there. See how easy it is to get out. It doesn't look too bad. Okay. All right, let's start to get this one out of here. Let's start to stitch this one up. Get some antiseptic on here because bullets are not clean. Then let's look at that thigh. See if it hit anything, any arteries. See if it chipped the bone or anything. I'm seeing chip. Okay.
Well, if not, I wake up in the middle of the night with a major headache. We know why. Well, the thing is, the kids always got this. That's why they get. No, it's fine. What could go wrong? Lots of things. Minor concussion from a golf club is so fine.
Yeah. Dr. Octavius, did I miss anything? Did it?
Alright, I'm sorry.
Oh, you're fine. I'm just trying to see if there's any complete fracture to the femur or if it's just a little chip off of it. That doesn't look too bad. Okay. Good thing the femur's strong. Just put a little bit of bone cement on the femur just to reinforce it. So it's not weakened by that little chip. And more monocle sutures. Let's get this closed up. And then do you want to just clean up those scratches on the left arm?
Yeah, I can do that.
Dr. Octavius, does she have an ID on her? She does not? Okay. Do you recognize her at all? For her, I need to get her name for a med report. Sorry, that was a Dr. Octavius question. Although, hey, if you recognize her, that'd also be helpful.
I'm gonna be honest, I only know her as Squeak Squeak.
Okay. Worst comes to worst, I can ask PD. Oh, Alara Jackson? Okay, perfect. Thank you, Octavius.
You're so cute.
Okay, let's stop the propofol and sucks and get her extubated and switch over to an mask.
396-510.
And that.
And
You
let's
are
push
being
Caldor and
required or
vancomycin
requested
for
in
pain
the
management
cells by an
and
Alexandra Langley.
Isabel's thing?
Yeah, they want me to drop possession, and I said no. So they're having a little hit. Having to, they're not very happy right now. They're requesting a 400 unit or higher.
Did she have it on her?
Yeah, she had 2 bags.
What?
Yeah, it's because I won't go higher than 5% reduction either. So they're requesting you. I'm unsure as to why, because they already know it's officer's discretion, but they have requested you nonetheless.
One more time, sorry, there's your radio going off.
Oh, I'm just checking her vitals. Make sure all of those meds I pushed are doing their job. It's kind of elevated. Let's do a set of labs. Make sure I'm not missing anything. Include a talk screen in that.
I got you. I'm gonna go take it over to the labs.
Yep, thank you.
Hey, baby. Hey. Hey. Beautiful. You're beautiful. I'm so sorry to scare you. Not letting me kiss you. You're being mean. Hello, you two.
Here.
It took me a moment to process what you were blah blah blah.
Do you have a first aid kit and bandages? I am
No.
God damn it, we're both useless. What did her lab say?
Hey, Onyx.
Arabella.
Are you at the hospital right now?
I am not. What's up?
Never mind then.
Arabella, what did her
I
lab
was
say?
sending them to you on the tablet.
If you need me at the hospital,
Yeah,
I can
I'm gonna
come back.
You're good. I'm just gonna run upstairs and grab, med kits because, kind of helpful.
10-4.
Apparently none of us are prepared. What the hell? This is awkward but cool.
Those are two very counteracting things, but okay. Okay, let's get a reposition on the bed again, and we can round 2. There we go.
Round 2. I did have bandages, I just didn't have med kits.
That's fair. Okay, let's get back on the bed. We'll just wait for her to wake up. I just realized we're waiting for her to wake up when she's ICU. I'm a dum-dum sometimes. I'll let PD know. She's gonna be ICU. Just to let you know. I assume she's a 95 and she's definitely ICU.
He's a 95, so that means we'll need a transporter or to Bolingbroke ICU. Sorry, I don't know if you actually heard me because I was looking at the NDT.
Yeah. She is all packed and ready to go.
Take a nap, go ahead and take a nap.
Remember, if she pulls out class 3, please do not get into a direct line of sight. Get yourself to safety first, and then she fires and we can return. I will have my class 3 unranked.
Also, if she's pulling that class 3, there's no discussion. You make sure she's
Not sure, but yeah, looks like a broken arm.
Can you guys hear me now?
Yes, I can hear you.
Yeah, there we go.
Oh, yeah. Thank you so much.
Now going eastbound
yeah,
around
stupid
Boulevard.
choices, you know.
What happened?
You know, it happens.
Yeah, I think I remember. My arm is kind of broken now. I tried to do like a jump, but
Broken?
I failed. Yeah.
Okay.
The right one.
We're gonna put a spin on that. If it's broken, we're gonna have to take it out of the hospital and get you
I don't know if that was intentional.
Oh, okay.
Alrighty.
So it's skidding all over the place.
Did you want to like?
We're going back to the factory just off of the westbound.
Just like
Come back round. Should be
It's
coming
from
out
a friend.
back
It's
on
not
Article
mine.
now.
You can, come here and grab it.
How should you feel?
You wanna at least lock it?
Past the Raven factory.
At least
Into
I don't
the
have the
Raven
keys.
factory. I fucking hate this place.
Oh.
Oh, we're
Okay.
gonna go for a run. Can somebody get in the other side?
I'm gonna go.
Yeah,
ahead
I'm on it
and
now.
I'm gonna help you just in case.
Alright.
I'm gonna go ahead and get you down to the hospital. Okay? Is he
Thank you.
No.
Okay.
I'll follow you there though, just to be safe.
Got the other end blocked if we
That
can.
was awkward.
The whole make sure we're safe is we have somebody who's fucking trying to
seen it just yet.
get one of ours for some fucking reason.
Someone go back on the
No,
other
it's okay.
side just in
We're
case she
doing our
decides
job
to loop
because we're
around.
mandatory.
Yeah, I need
we're
someone
mandatory
covering the garage door,
workers.
please.
Is anybody not going into the other entrance? What happened there?
I'm trying to find it. It's at the other. It's on the main road.
I know where it is. I'm going. It'll be too late now. She'll have come out the other side. I don't see her at the other side. Entering the other side.
Echo 11 to Echo 3.
Send it.
Down to 2.
April. Send it.
I'm coming down lower with this patient. I'm also going to put the ambulance down lower just for security and safety reasons.
Hey, firm, do us a favor. Wipe the call sign off the top of that. Just leave it blank.
Yeah, because I totally know how to do that.
You know how to change the call sign, yeah?
Yeah.
Instead of putting a number, just don't put anything. Does that make sense?
Huh, okay.
Yeah, fun little fact.
Hold on, let me
Sam's to PD.
send it.
Send it!
It's finished. We'll need you down at the ribbon factory if you got a bus for us.
Oh, I'm coming.
Sounds like we have.
Dang, the
Careful.
excitement.
Never mind.
Right, heading up to.
Okay, we're gonna go ahead and do everything then,
Did she drop Jackson or she still got him?
I am, I'm also a doctor, so I can go ahead and help you out with, your arm. We're gonna do everything down here for safety reasons due to your situation going on, so I'm gonna go ahead and bring you in here and we're gonna do the scan here.
This one or that one?
What? Yeah, speak up.
This. Okay.
Yeah, we have a portable scanner that we use in this room for safety precautions. Alright, I'm gonna go ahead and use this portable scanner. I'm gonna check the the brake here, the scanner, seeing if there's any signs of, well, an actual break, and if there is, what kind of break it is, so if I'm gonna need to do surgical intervention or not. Okay. So I see the fracture there.
Oh. Is that brand news?
I'm gonna see if this fracture needs surgical intervention or if it just needs a casting.
Okay.
There's different kinds of fractures. You could have a messy fracture, which would need, you know, cleaning. There's the hairline fracture, which is just like, they'll heal on its own. I'm sorry, let me look at that one more time. I missed it because stuff happened. Alright, looks like it's a hairline fracture. I'm gonna go ahead and...
Oh, thanks God.
I am gonna cast up your hand here in a resin cast. You do not need to have it... Excuse me, you do not need to have it in a sling. I'm hiccuping, it hurts.
Evidence collected our process vehicle as well, and we're all good to get the Raven factory.
I'm gonna go ahead and make the resin pink.
Here. Any units at 10 to the latest 150, that would be cool.
I'm gonna be so drippy with this big thing. I think so.
58 plus 1 more.
Cheers. I'll grab a repair and join you.
71's at pillbox with a possible 95.
10-4.
Alrighty.
Got a white car bravado just parked, well, actually dumped in the middle of the street. One individual just ran to the back. Oh, it could be a bike. Hold on. I'm gonna ask someone to get BF just in case.
Oh, I'm feeling much
I can grab one if you want.
much.
Yeah, there's a bike tucked in the alleyway here, so I just want to make sure it's not that car, that bike that we're chasing.
Man, I tell you that my arm is kind of, you know.
Good.
He'll be good.
That's all.
Alright. I just want to have a quick chat with you now that you're feeling.
65676 MRPD evidence.
Is that everybody clear from the Raven factory apart from me and Combo, yeah?
10-4.
Alright, awesome. I'll start writing an OIS report.